Hi, my name is Dr. Erica Steele with Holistic Family Practice, and I'm the founder as well as the organizer of this practice. More and more families are choosing holistic medicine as an option for their families. I'm so excited to see this because years ago, it really wasn't as popular as it is now. More and more families are choosing this option and getting away from some of the traditional allopathic practices. With that being said, the role of a pediatrician is still important, let's say if a broken bone happens or a need for an antibiotic, or if a family chooses to vaccinate, that's really the role of a pediatrician. They want to make sure the developmental aspects are still there for the patient. Now, with that being said, I really work to augment that. I also do a lot with perinatal care, that's getting the mom ready to give birth. A lot of times women don't prepare their bodies to get pregnant or give birth. And so my role is to help them nutritionally, help them through that whole process to get their microbiome healthy, because the first 2 years of life is really, really important to the overall development of the actual person. Once we develop a really strong perinatal process, I work the person through prenatal care. So that's different from what a standard OBGYN or obstetrics is going to do, gynecologist is going to do, because again, I'm looking at the nutrient deficiencies, accumulated toxins, and really working with them on their gut. Majority of the immune system, hormonal system, as well as the neurological system is housed in the digestive system. So making sure that that's nice and healthy and viable for pregnancy is very important. Oftentimes I work with people with infertility issues, and it's all about healing the gut. Working with PCOS and different adrenal, blood sugar dysregulation issues also is very helpful for women that are looking to get pregnant. We also work with postnatal care, so helping mommy get back into shape after she has given birth and making sure that they have a natural health process through that whole experience that they want. That may be connecting them with midwives, doulas, different birthing centers, and helping them to create a natural birthing plan that works for them. I work with all ages and all stages of life growth and development. So as they come out and they become babies, I also can serve as their more holistic side pediatrician, although I'm not a pediatrician. As a naturopathic doctor, we do serve a lot of roles for different people. Especially with the advent of antibiotic usage, we try to reduce that down as much as possible. We offer sick care visits for little kids, as well as elderly, as well as people that are just well in general, who get sick with cough, cold, flu. We do a $50 sick care visit, same day appointment. I'll do an AK test with them to be able to determine if it's bacterial, viral, a parasitic infection, or sometimes, believe it or not, it's not. It's either a heavy metal or a chemical. Once we discover what actually the cause is, then we treat that cause either using a homeopath or an herb, or again, like using our basic detox service, like our biomat or our dry sauna, to increase blood flow circulation and burn those things off. So once a person's come in for a sick care visit, they can opt to, especially if they keep coming in often, we say, you know, if you've been coming in often just for using sick care visits, you may want us to evaluate lab work to see what's going on with the immune system. This area is filled with mold, just as a result of all of the water that's spread. So a lot of people have mold issues in their bodies and they're not realizing it. Oftentimes when a person has mold in their body, it weighs the immune system down. So chronic infections, like if a child keeps getting a cough or a cold or just can't seem to kick it, a lot of times it's because of either a toxic substance that's in their home that they're reacting to or mold exposures. As we're working with the family, we also work on a lot of behavioral things. We teach the children how to take personal empowerment over their health, take responsibility for their health. We teach them relationship between cause and effect. We teach parents how to parent. We teach married people how to stay married, all kinds of different dynamics, even co-parenting. We really work with all stages and all aspects of the family process. In addition, we also work with patients on eating healthy, families on eating healthy, individual people eating healthy, as well as a lot of specialized behavioral challenges such as autism, ADD, ADHD. We also work with the schools and make sure that the school system understands what they're dealing with and working with, making sure that we're not labeling the children as wrong or damaged or any of those things, to really boost self-esteem. We want to make sure that we're not sending an incorrect message to all of our youth, especially as they're growing and they're developing. It's really important that we recognize that everyone has multiple intelligences, and we really support that within our homes as well as with our environments. Holistic Family Practice, we bring care back to healthcare.